Hi, so this is the next film, the third one in the series that's associated with the roles and responsibilities of the staff person, the CA, if we call them that. Sometimes in Canada they're known as the chiropractic health assistant, CHA. And so, what I really would love to do is talk a little bit more now about the reporting process. Now, again, this is a procedure that is mostly done by your doctor, but at the same time, this is where you can support and have a great role in allowing the patient to get more ease and comfort in the direction that they're going to go. What your doctor is going to be trained to do is use the core score primarily to report on the scoring of that amount of tension or the neural efficiency within the spinal nerve system that's going to be interfering in that patient's either present health or future wellness. And so what we really love to do is get you just a little bit more oriented as to how these reports make sense. Because again, the patients really want direction, especially when they're making financial commitments, time commitments, and otherwise in the practice. So here's the bottom line, is that a score of 100 on a core score is ideal. It means that all the three tests, the SEMG, the thermal scan, and the HRV, are working as they should. Now, it's very easy to sort of compare the test results in a core score to that we used to get in school. And for instance, anything over a 90 would be an A plus, anything over an 80 would be an A, and we start to get into the B's in the 70s to 80s, and C is pretty average. You know, that's when we start to get 70 and under 65, that sort of number. So you can start to think about that with your reporting or your comments to the patient. Say, oh, you know, that's great, you know what, you're about a B, and that means that you're not too far off of the average, but you've got a lot of room for improvement. On the other hand, you know, when you see somebody who scores down in the 60s or so, you know, that's like, you know, that's pretty low, that's a C, and that means that the doctor is going to have to give you some great advice, and that you're going to have to follow that advice to get those scores moving upwards. Just like in school where you had to do some extra work, it's the same in a chiropractic setting, is that you have to work a lot of different things, not only the adjustments, but the way you make choices in your life to get that moving from a C to a B and hopefully to an A. But again, you know, Dr. F, in this case, Dr. Fletcher, is really one of the best at doing that. And he's going to work with you to try and help you understand how you and your family and your body can start taking these next steps. So that's the kind of dialogue that a core score allows a staff person to have. Of course, that's one of the things that they rely upon. I mean, we all know that the most important person on a visit is the staff person because they see you twice. You know, they see you on the way in and they see you on the way out. And so as a result of that, they're really looking to have that conversation. How am I doing? You know, what's going on? And of course, there's this trust bond that they have with staff. And so the more you know about what a core score means, the more you know about how you can guide that patient. Great, you know what, I can't wait to see you're getting your re-exam in 3 visits. Let's really see if we can get you in from that C that you were at to closer to the B. I'm excited to see where you're going. If the doctor isn't using the full core score, then the individual scans offer the same sort of process, except there's a little bit more about looking at the colors and the graphs versus just looking at a score. So for instance, in the SEMG, which is the muscle tone test, and the thermal scan, which is the organ, gland, and blood vessel, if you will, tension test, those show up in those 3 colors of red, blue, and green. And what we can really start to tell the patient is that when we see red, it means that you're further from where you should be. And when we see blue, it's a moderate amount of tension. And green means that you're either getting better if they're moving towards that, or you're just out of the normal ranges. So our goal is to see that your body can hold more green and clear than the blues and the reds. And that's a simple conversation to have. It also is important for the patient to understand, because sometimes, and it's very common, that these scans show a lot more color, especially as they start the process. And you have to have the confidence to know this, and I hope you're hearing it from me, since I'm sort of the scanning expert, is very simply this. By the time we start changing something that's been in the patient's system for a long time, I always sort of glamorously refer to it as throwing a grenade in their garbage can. The truth is that it blows the lid off of all those old patterns, and the muscles have to work harder. The nerves that control the glands have to reorganize. And many times on the scan after the initial one, so the first re-exam, there's a lot more color on those. And your doctor will teach you this, but the truth is that that's considered reasonably normal. It's really the third scan that makes all the difference, because by the time we get the third scan, we haven't just watched the change, but we're really looking at the whole relationship of what we're talking about, this pattern changing or the trends that are being delivered. So it's really important, if you really get this going on, to understand that we are building what we call a scan folio, an initial. We then go and do a second scan, which is the progress exam, and we do a third scan, which is called a comparative examination, so that we're comparing the three scans and observing trends. It's really important as a staff member to have the confidence to tell a patient that although one scan is important and the second one might show a lot of the changes that the doctor needs to understand, it's that third scan of where we'll understand how well your body has accepted these. So really keep your eye on the prize, which in this case is the change and the tension that has changed over those three full scans. Of course, we understand also that that's really just the start of somebody's career in terms of being a patient in chiropractic. These scans that we're talking about should be done minimally each quarter within a patient's care life. And that means that every 3 months, we're looking to see what their core score is. Sometimes that's a bit onerous on a patient, so make it 4 months. But don't try and stretch it to 6 months. There's too much information about the stress in their life that is going to, really go further than they should if we start stretching this to 6 months. So I'd really like you to start getting the first 3 scans built into probably a 12-week period so that we've really seen enough change over enough time. And then commonly we start to look at 3-month intervals. Minimally, that should be at the extent. The other side of that is that many doctors just decide, under my guidance, to just scan every 12 visits with nothing longer than 3 months and just call it that. I think that sometimes is the easiest way to understand the value of this scan sequencing. So when we talk about the fourth one, which is the report that we get from the inclinometer, as it's called, a range of motion. Really, it's just a bar graph, and it's very easy to see that somebody has less movement improving. And the same goes for when we start to do the algometer, which means that what we're seeing is that the patient has a change in the way their mapping goes. And again, it's on those 3 colors of the red, the green, and the blue. So I hope this has been a bit informative in terms of how you as a staff person can be incredibly involved in the relationship of building care planning for the patient, but that confidence they need to know that you and the doctor are absolutely on the same page, which means that they're really investing in the team approach to themselves getting extremely exceptional care in your office. Have a great day.